Erectile dysfunction medications are highly effective treatments. They reliably solve a specific physical problem, but treating them as an over-the-counter shortcut for any kind of bedroom issue has created a hidden, growing danger. The most famous option is sildenafil. It delivers an immediate, intense physical response, designed for a highly specific time frame. Then there is Tadalafil. It trades some of that peak intensity for a prolonged window, allowing for more flexibility over a couple of days. Deciding between the two requires matching the pharmacology to your specific lifestyle. And for many men taking these pills, the right choice is neither of them. Throwing a biochemical override at a psychological barrier will not resolve your anxiety. It trains your brain to rely on a crutch, turning a temporary mental block into a long-term dependency. Let's be clear on exactly what these drugs do. They are not aphrodisiacs. They do not generate desire or create arousal. They simply manage plunning. This chart outlines the mechanics of a natural erection. Physical or mental stimulation signals your brain to release nitric oxide. That triggers a messenger chemical called cGMP, which relaxes the smooth muscle in your blood vessels, allowing blood to rush in. Naturally, an enzyme called PDE5 breaks down that cGMP to return your body to normal. These medications work by blocking PDE5, keeping the vessels wide open. But here is the catch. If there is no initial stimulation, your brain never releases nitric oxide in the first place. Without that spark, taking the medication does absolutely nothing. Because these pills only override the mechanical exit valve, they cannot compensate for a lack of intimacy, a poor relationship dynamic, or performance anxiety. If your physiological systems need mechanical support, your choice comes down to timing and intensity. Sildenafil is for the precision planner. Looking at this chart, sildenafil between 25 and 100 milligrams hits fast, reaching peak efficacy 30 to 60 minutes after taking it. It holds that peak for 4 to 6 hours, providing maximum physical firmness before leaving your system completely. The trade-off here is straightforward. You get absolute reliability and peak intensity, but you surrender spontaneity. You have to plan intimacy around a clock. You also have to plan your meals. Heavy, high-fat foods or alcohol will heavily delay absorption, neutralizing the drug's primary advantage of speed. Sildenafil works best when you are willing to accept strict scheduling rules in exchange for guaranteed maximum intensity. Tadalafil takes the opposite approach. It is designed for those who value flexibility and want to remove the pressure of a ticking clock. This chart maps Tadalafil's slower absorption. Taken between 5 and 20 milligrams, it requires a longer runway, up to 2 full hours to become active. Once activated, it stays in your system for 36 hours. Take it Friday evening, it remains effective through Sunday morning. The cost of this flexibility is a slight reduction in peak physical firmness. It gives you steady readiness rather than maximum intensity. And because it stays in your bloodstream for a day and a half, any side effects you experience, like indigestion, a blocked nose, or back pain, will also stick around much longer. If you prefer spontaneous intimacy over the course of a weekend without strict scheduling, Tadalafil is your practical choice. There is a specific demographic where these medications are being heavily misused: physically healthy men in their 20s and early 30s. At this age, erectile dysfunction is rarely tied to cardiovascular disease or diabetes. The root causes are usually performance anxiety, chronic stress, and unrealistic expectations driven by pornography. Applying a pharmaceutical blood flow enhancer to a stress-induced problem is a mismatch of tool and task. The pill will force a mechanical response, successfully pushing blood into the vessels and creating what feels like a victory. But that immediate success masks the actual issue. The performance anxiety remains unresolved, and your brain begins to associate physical capability solely with the pill. You lose confidence in your body's natural function. Over time, achieving an erection without the medication becomes increasingly difficult, not because your body is failing, but because your mind expects the chemical trigger. By treating a psychological block with a physical bypass, young men create chronic, self-inflicted dependencies that require significant work to undo. Before committing to any prescription, you have to look at your baseline health. Pills are a patch. How you treat your cardiovascular system is the actual cure. Carrying excess weight and living a sedentary lifestyle restrict healthy blood flow. Regular cardiovascular exercise and strict weight management actively repair your blood vessels. For many men over 40, hitting the gym regularly eliminates the need for medication entirely. Smoking directly damages your vascular health. Nicotine and tar severely constrict your blood vessels, physically blocking the exact pathways these medications are trying to open. On the psychological side, no pill replaces an honest conversation. Communicating your anxieties with your partner is the most direct way to eliminate the mental pressure that causes dysfunction. A prescription gives you a temporary mechanical override. Disciplined lifestyle changes give you permanent cardiovascular and sexual health. Let's organize these options into a clear framework. This chart matches your biological reality to the appropriate intervention. If you are over 40, experiencing physical blood flow restrictions, and want maximum intensity for a specific planned window, your choice is Sildenafil. If you still have physical symptoms but prioritize spontaneity and want a single dose to cover an entire weekend, Tadalafil is the proper fit. But if you are under 35 and physically healthy, step away from the pharmacy. Address your stress, limit pornography, and communicate with your partner. Regardless of the path you take, never treat these drugs as recreational supplements or buy them without a medical consultation. Always secure a proper diagnosis from your doctor. Intimate health isn't found by simply swallowing the strongest pill available. It comes from honestly identifying the root cause of your issue and applying the exact intervention required to fix it.